Right, we'll move straight on, and next up is Dr. Harvey Lander. He is going to speak next and open the meeting. So from he's Director of Systems Improvement from the CEC, so welcome.
Thank you. Okay. Thanks very much, Stephen. Thanks for the welcome, Raymond, as well. And welcome to everyone here for the 32nd Academy Awards. No, that's New South Wales Falls Prevention and Healthy Ageing Network Forum. So warm welcome to everybody in the room, and it's great to see so many of you here, and also to those online as well. We have similar numbers. So the Clinical Excellence Commission is very delighted to continue to fund the work of the network, and I wish to thank all those members involved in the network and the work they do up front, and you as well. We recognise and value the contribution of all consumers, patients, carers, loved ones, and staff as partners in healthcare. And as a former medical director, I always say our staff are our greatest asset. Yourselves in the room who do the work to prevent falls and improve healthy ageing for all of us as we age is so important. And the voice of people with lived experience are powerful. Their contribution is vital to the work that we do continuously to improve safety and quality in our healthcare system. In partnership with hospitals, the CC works, and also in the community to ensure patients, their families and carers have a positive experience of care. And we strive for patient safety for every patient every time. Now, obviously, today we're really delighted to see you here to continue the work to improve the care and prevent older people in New South Wales from falling and suffering preventable harm. Now, when this forum was starting 32 years ago, I was starting my medical degree, and I knew very little about falls, and I have to admit I don't think I learnt much about falls at all, except that when I came out as an intern, I think a nurse said to me, make sure you fill an IMS, or we need to fill an IMS out, so make sure you tell us. And I said, what's an IMS? And there wasn't really a lot of knowledge about falls, and we weren't taught much. And over the last 20 years, I think with the work and the research, but also the translational research in clinical practice, we've seen incredible gains. And now we believe that we can prevent a lot of falls, and I think that's really important. And so I've seen the focus from just responding to the clinical fall to actually thinking about preventative actions, team-based individual actions that we can take. We've got lots of great evidence now, and I've been fortunate enough to learn about that, and also to see and experience the work that you're doing each year and hear about the amazing work that you do every day to improving that right across the spectrum. So in the community setting, of course, in hospitals as well, and residential aged care, MPSs as well. And of course, as we all age, we know we're getting older people in our community every year. We know that there are more complex comorbidities resulting in more hospital admissions. We know the falls in older people are increasing. So we had in 2021, there were 1.4 million people in New South Wales aged over 65, and by 2041 there'll be over 2 million older people. Now we want those people to be living healthy, productive lives, and we also know that the cost of falls is enormous, both for the individual and their family. The sequence of events that can occur after a fall can include, of course, admission to hospital, extended length of stay, rehabilitation, increased costs, potential admissions for longer term care, and even death. So these are things that we think are worthy of preventing. And we know also that the research takes many years to get into practice. It can take 15 to 17 years. We want to ameliorate that, speed that up, so that when we're doing research that we put to practice, we can actually make a bigger difference in a faster period of time. So today you'll be hopefully inspired by a number of wonderful people in the audience. The opening plenary session this morning is focusing on care homes and nursing homes. In front of me I have the PAM Albany guest speaker today is Professor Pip Logan, who tells me that she was sought after by Australian University here, and Professor of Rehabilitation Research and Occupational Therapist at the University of Nottingham and the University of Queensland. So we'll hear all about preventing falls in care homes, and she's very proud of the work she's doing, and I think she'll never retire. We also have Dr. Rick Dawson speaking to us about preventing falls in nursing homes, Professor Kathy Sade working with people from CORD communities to reduce falls. We have Professor Ruth Peters on dementia prevention and practical risk reduction. We have Dr. Yoshi Akubo looking at reactive balance training. Now, I was talking to my son this morning, and he's 17, and I was talking about falls, and he was giving me a speech about how important falls prevention is, sarcopenia. He was talking about what happens at the microscopic level. He said, Dad, they need protein. Older people need more protein. They need to exercise. They need to be in the gym in their 70s and 80s. And anyway, so after a while, I said, why don't you come and give the speech? He said, no, that's okay, Dad. But there's hope for us. If 17-year-olds can talk to me about the neuromuscular junction and what happens to it when they're much older, and he's not even studying medicine, I think we've all got hope for. So, and this afternoon we'll also hear from Professor Kim Delbare, who'll present the yearly research update, followed by a wonderful panel discussion and bring it all together with the wonderful Professor Stephen Lord, who I'm very grateful as well. So please encourage you to take the opportunity to network at the breaks, be kind to each other, be curious and profit from the expertise that's being shared today. And I can't stay. I'm sought after. As the last speaker, I've got to go and do some more welcome at other forums and meetings. But thank you very much and enjoy the day, and I hope you learn a lot from others. Thank you very much, everybody. Thank you.